Starting July 1st, fluoride will be flushed from some 23 million Floridians' water supply, making Florida now the second state after Utah to strip the scientifically proven tooth-strengthening mineral from its public water system. NBC's Jesse Kirsch is reporting on this story for us, and also with us, we have NBC medical contributor Dr. Vin Gupta. So welcome to both of you. Doctor, you first here. How concerning is it to you that we now have a second state removing fluoride from its water supply?
Well, Alex, I think this is indicating and signaling what's happening across the country, which is a bent knee approach across some states to public health policies that frankly have no evidence or grounding in reality. And so, we know that fluoride in the water supply helps prevent cavities and that it is kept within very safe limits because it's constantly being monitored. And so we know that 0.7 milligrams per deciliter, for example, or per liter is the safe level. And there are not unsafe levels of fluoride in the Floridian water supply. And that's what the purpose of the EPA and the U.S. Public Health Service is, to monitor that. But as the EPA continues to get defunded, will they be able to do that work moving forward? We'll see. But there is no issue here. This is complete smoke and mirrors.
You just anticipated. I was scribbling down with all the funding cuts. Are they still going to be able to safely monitor this? But let me ask you, Jesse, because you're in Miami. What more do we know about this? What are you hearing?
Well, so this is something that had already been picking up steam at the local level in some communities, including here in Miami. Alex, the county board had voted to remove or to not allow adding fluoride to the water anymore. The board president had vetoed that. That veto was overridden. And so Miami was one of the communities that was already going to be moving forward with taking fluoride additives out of the water. But the governor, in talking about this bill signing, said that counties doing this on their own wasn't enough. He wanted to see this at the statewide level. And just one other thing I want to flag, the doctor, I'm sure, could elaborate on this. One of the things that concerns proponents of adding fluoride to the water is it's seen as an equalizer. Whether you are rich or poor, whether you have access to a dentist, whether you go get your teeth cleaned regularly or not, the fluoride in the water was giving that tooth decay protection. And according to some studies, according to the ADA, the American Dental Association, by as much as 25%, we were seeing a reduction in tooth decay. Again, rich or poor, it did not matter. And now that equalizer is going to be going away for people in this state.
That is a really good point you make. Jesse Kirsch, thank you so much for that. Let me pick up on that with you, Doctor, because we have the Tallahassee Democrat reporting that Governor Ron DeSantis called fluoride forced medication. He did so at the bill signing yesterday. I mean, how dangerous is a statement like that? You heard what Jesse said about how it really evens the playing field and gives everybody a chance, certainly kids on up, at having healthy teeth. What do you recommend people do after July 1st?
Well, this is complicated in the sense that this is really frustrating. And what they're trying to do is they're cherry picking data and misinforming people. This is their playbook. Let's just take a random data point here that is not relevant, is not causing a problem, and then scare people. This policy in Florida, the second state, is a solution in search of a problem that does not exist, to be clear. Jesse's exactly correct. Fluoride in the water supply is safe. It promotes it de-risks the risk of school absenteeism because of dental problems, and exactly that. For those that, for example, can't afford access to a dentist because the supply of dentists is not great. Not everybody has regular access to that. This is an equalizer. We know that safe levels of fluoride exist throughout Florida. It's not an issue. It's never been an issue. And it prevents tooth decay. That's the whole point here, especially amongst kids. And so, again, this is a solution in search of a problem that does not exist.
And this comes a couple days after HHS Secretary Robert F. Kennedy Jr. testified before Congress about vaccines. Let's take a listen to that.
If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant. I don't think people should be taking medical advice from me.
I'm sorry, he's the head of HHS. So if not him, who?
That's a good question. And let's broaden out from just him. He's surrounded himself with doctors who are doctors in name only. They aren't doctors like myself and my colleagues that actually care for patients. His Surgeon General pick doesn't have an active medical license, never actually completed residency. Dr. Oz has spent most of his time now in the wellness space, far removed from clinical care. His head of NIH